exactly what you believe to be important. And C, community assets. So when we think about assets, an asset could be a person, an asset can be a resource, meaning a program or an activity. An asset can be an organization like your local NAACP unit or branch. And the asset could be, the ability to exercise your power or your capacity to achieve a stated outcome or goal. So we're talking about how we're using the feedback through those other measures to understand what the assets are in community, as well as looking at the literature, the public health data, and understanding your neighborhoods to say, hey, this is how we actually advance issue and policies that are integral to health equity. And finally, emerging technologies. What is that, right? That's a big word. What does that mean? That is what tonight is all about. Tonight, we're going to talk about, you may have heard AI in the title of tonight's webinar. What does that mean? Artificial intelligence or machine learning. What does that mean? We want to make sure that you leave this webinar with all of your questions answered. And if you have any concerns or if you say, hey, I'm not quite sure about that, we want to help you understand what the opportunity is, what the power is that we collectively have to chart our course and to make sure we achieve health equity. With that, Dr. Tony, can you advance the slide? And I yield you the floor.
Perfect. Thank you, Dr. Chris. Thank you, thank you, thank you. So for those of you all who may not have heard this, track A is going to be our actionable insights track. That is the thing you've probably heard the most about the Ace Your Health project. This is going to be our opportunity to really engage with the people, engage with community. As you all are aware, we've been doing the Ace Your Health Community Wellness Survey since the beginning of this year. We have been across the country. We have done door knocking. We have done canvassing. We have done focus groups. We have done everything under the sun to learn from you all about some things that are important to your health. As you all are aware, we have a goal of hitting 12,000 completed surveys. We have a goal of engaging 50,000 community members. We are so thrilled and so pleased, drumroll please, we have crossed 20,000 surveys completed. And that is thanks to all of you all. Thank you, thank you, thank you for leaning in. Much appreciated. We have engaged with over 2 million community members, and that is thanks to all of you all. So we certainly do appreciate it. Would not be the same unless we took a minute to just share about the Ace Your Health Community Wellness Survey. If you have a smartphone, if you're on a computer, I'm going to drop this link in the chat. That is the link to the Ace Your Health Community Wellness Survey. We are asking about neighborhood resources and assets, neighborhood quality and affordability, health and healthcare, and most importantly, about you, the person taking the survey. Now, granted, we have crossed our threshold, but we are not done yet. We need your help to continue getting this information and continue learning about our community so we can make the important changes and advocate for what is important for us. Now, as we continue on, you can see track C. This is going to be talking about our community assets. The best way that I can describe this is going to be looking at different disparities in community and identifying those. And on the other side of that coin, we're going to be identifying different opportunities and different assets that can be replicated across the country. A couple of things that are going to live in this particular track of work. Of course, as you all know, the Ace Your Health report. Once we are done, we are going to do a national report that is going to be available 2026 that we can showcase and highlight, people will have access to. And then, of course, our targeted geographies each are going to get a one-page addenda in addition to the national report. So really excited for this and really important for the work that we're going to do here. And then the reason why you all are here tonight, Track E. The goal of Track E is to advance emerging technologies with a gender and racially inclusive lens, right? We're going to deep dive a little bit into this in just a little bit, but just want to kind of set the stage here. We're doing some artificial intelligence and machine learning analysis, a health equity framework. We're going to be engaging several thought leaders, some of whom we have on the call tonight. We're going to be talking about policy development. And most important, we're going to have a task force that we have some of those members here tonight that are going to be producing a white paper for us and for you all to really learn about AI and ML. So with that, what I want to do, I want to actually call Dr. Chris back into the conversation if I could to really kind of set the stage for our task force chair.
Thank you, Dr. Tony. And I just want to applaud all of you who are on tonight. We have a very energetic NAACP family. And for those who may not yet be a part of the NAACP family, you're welcome to join us, but thank you for being on tonight. We're loving the feedback. Yes, it is being recorded. We're loving the feedback that you all are giving us. And now we're getting to a part of tonight's webinar that I think is most exciting. You heard Dr. Tony explain all three tracks, ACE, ACE, and you heard him say, look, you're going to be able to ask questions. And who better to ask questions of than people who are doing the work, whether it is in thinking through AI as a platform, as a practice, as a policy, and how artificial intelligence is able to impact our communities, or whether it's someone who can have a conversation with policymakers themselves, or someone who can then distill that information to our membership, into the general public, so that one, if you have any fear, and I want to use that word because that's hanging out there in the atmosphere, that tonight we address it and we say that we can turn fear into power, and power in the ability to shape, to guide, to direct, and to harness the benefits that could come from AI to ensure that our communities have their issues met and solved. And with that, we brought along our task force chair, Dr. Craig Watkins. We're going to bring Dr. Watkins on the screen. But I can say this in advance before he joins us to say a few words and we ask some questions. The professor is in the house, but not just the professor is in the house, the person who's going to be our narrator, or the person who helps us decipher, or the person who asks those important questions so that we ponder more deeply, that we might be able to say, hey, how can we leverage and use this? So with that being said, I'm going to ask Dr. Tony to formally introduce Dr. Watkins, and then we'll yield him the floor.
Absolutely. And by no means, I am not going to steal Dr. Watkins' thunder, so I will be somewhat brief in his introduction. Dr. Watkins is the Ernest A. Sharp Centennial Professor and the Executive Director of the IC Squared Institute at the University of Texas at Austin. His research focuses on the technical, social, and ethical implications of artificial intelligence. His research explores the challenges of deploying AI in the context of high stakes like healthcare and other avenues. So with that, Dr. Watkins, please come on, talk to the people and tell them a little bit about yourself.
Wow, what an introduction. I want to say thank you to Dr. Chris and Dr. Tony and your team for organizing this event, and more importantly to the NAACP and your partners in launching the Asia Health initiative. From the minute that I learned about this particular effort, I immediately bought in, recognized the extraordinarily timely nature of such a program like this, and just genuinely excited about the work that you've been doing, the work that's forthcoming, and the impact that you're likely to have. As you both mentioned, we're here tonight to talk primarily about the track related to the application of artificial intelligence and machine learning in healthcare. And I thought what I could do is perhaps provide some sort of initial kind of remarks to help frame, tonight's discussion But I oftentimes say that I consider myself first and foremost a learner in general, and certainly a learner in this space. And so I think myself and the task force, who you'll get a chance to meet here in a moment, that we're all both excited to be contributing to this work. But I think importantly, we understand the value that your membership's perspective, your interest, questions that you have will be critical to helping inform and shape the white paper that we will produce for you. So really excited to learn more about what's on your mind, what issues, what challenges, what risks, what opportunities excite you or concern you most about the application of AI in healthcare and the equity stakes. So please feel free to volunteer questions, raise points, and ideas that may help inform the work that we do for this particular and highly important initiative. It's hard to think about, where to start. I mean, I think most of us uh, in the world today are developing, a much greater recognition of artificial intelligence than we were just 2, 3, 4 years ago. Obviously, with the arrival of generative AI and more specifically ChatGPT in November of 2022, the reality is, right, is that AI has been around for several decades, and AI sort of integration into our lives and how we sort of experience the world around us has been present, oftentimes in ways that we aren't necessarily aware of, but are increasingly becoming aware of. What makes AI so, I think, important today is the degree to which it's increasingly being integrated into what we like to refer to as high stakes environments. If AI gets it wrong in terms of recommending or predicting what movie you might want to watch, or a playlist for you, or what book you might want to read or purchase, that mistake might annoy you, but it's not likely to cause you any serious or significant harm. But imagine, right, if AI gets it wrong in terms of a clinical diagnosis, or AI gets it wrong in terms of a criminal justice decision, those could have life-determining impacts. And so the stakes are increasingly high as we begin to integrate these machine intelligent like systems into, really important, social institutions that impact people's lives and life chances. And there's probably no stakes higher than healthcare, in terms of what we're beginning to learn about the adoption and application of AI to diagnose disease or to diagnose a health condition. Increasingly using AI, for example, to for drug discovery and drug development, to respond to chronic conditions and disease or various kinds of health conditions. And certainly just the ways in which, clinicians, but even quite frankly, just everyday users are beginning to rely upon AI systems like large language models just to access health information, just to perhaps engage in a query of some sort as a second opinion, or as a way of perhaps trying to understand a speculative health condition or health matter for yourself or for a family member. In other words, AI is becoming increasingly intertwined into how we understand and experience our health and our well-being. And so what we're excited about as a task force is to prepare for you what we think is the state of the art kind of evaluation and assessment of both where we are today, and in some respects where we think we'll be in 3, 5, 10 years or so as this technology continues to accelerate. The equity issues in terms of the application of AI and machine learning are quite significant. And when I talk about artificial intelligence, I'm thinking about machine-like systems that are increasingly capable of performing a human-like intelligence. So think about some of the things that historically or traditionally we've sort of presumed that only humans could do. Recognize images, translate language, make decisions, speech recognition, for example. These are all things that increasingly systems are being able to do, and in some respects do them as better, and in some cases even better than humans can. And so these systems are becoming increasingly sophisticated. They're becoming increasingly sort of integrated into all aspects of our lives, including healthcare. And yet, there still are no fully established regulatory parameters, policy frameworks, sort of recognize principles for how one would integrate AI into a healthcare organization, into a healthcare system. And so that's a whole dimension of what we will address in the task force is, what are some of the policy questions? What are some of the policy issues? How do we ensure that when a decision is made with the support of an AI mechanism, that decision is understandable, the decision is transparent, that it's explainable? These are all things, right, that are going to be significant in terms of building a policy future that's right fitted, if you will, for the occasion and for the challenges that AI will present. What rights do we as patients, as citizens have in terms of our data? Who has access to our data? How our data is used? So there are issues around privacy, issues around security that are quite critical. And so these are all things that we will certainly be addressing in the policy paper. Equally important, right, are just the different sort of applications of AI in the healthcare space. And there are far too many to mention or note in the webinar time that we have tonight. But just, as I think about this, as we survey the literature, you'll meet tonight, colleagues of mine who are doing incredible research in this space from a medical perspective, from a social psychological perspective, from a social scientific decision-making science support perspective. We think it is a multi sort of disciplinary and expertise task force that we put together. And we think that we'll be able to present to you, I think, a really compelling case and roadmap for how we both understand the current moment and the future in terms of what's at stake. But what we're seeing is AI being used in a number of ways, for example, to help with diagnostic reasoning. That is to say, to help clinicians diagnose a condition that presents itself when they meet a patient who has various constellations of symptoms. We understand that these systems have the capacity to be predictive. That is to say, to be able to predict the onset of diabetes or the onset of some other kind of chronic disease before it happens. And that's one of the things that really, I think, excites people about the technology is the degree to which it can not only understand and recognize patterns in quite striking ways, but even provide signals or provide input or information or feedback that may serve as a predictive or a preventative measure that I think will become important. So as we think about AI in the future, and particularly AI in underserved populations, right, the degree to which the technology is designed, engineered, and deployed in ways that can help prevent the onset of many of the chronic diseases that disproportionately affect, certain segments of our population. We're also beginning to see the ways in which AI is being used to inform and modify behavior. If it's diet, if it's movement, if it's activity, if it's social support, if it's adherence to medication protocols. There's certainly really striking sort of behavioral aspects to this technology and how, when designed and deployed properly, it can support, enhance, and augment behaviors that lead to healthier outcomes. AI is increasingly being used to do risk stratification, so helping clinicians and helping clinical teams understand which patients are at most risk, and then how do you allocate resources? That is to say, how do you allocate staff? How do you allocate clinical expertise, medications, and other decision-making processes that respond to who's at risk at any given time? And so the ability to sort of stratify risk, to understand how risk is distributed, is something that I think is really critical and something that we're beginning to see various kinds of applications of the technology in this way. And as I mentioned earlier, there's just been some really striking breakthroughs in terms of understanding how AI can be used to help identify new drugs, the development of new drugs, which can be responsive to a range of conditions. And sort of at its core, with all of these applications, and these are just sort of the sort of tip of the iceberg applications, but at its core with these and other applications is this question around equity and fairness and disparate impact. Who will have access to these technologies? Who will lack access to these technologies? Who's most likely to receive an accurate prediction versus who's most likely to receive erroneous prediction of some sort. And so you can begin to imagine what's at stake, right? If these systems aren't designed, if they aren't informed with data and informed with algorithmic procedures and fine-tuning mechanisms to ensure that they're responsive to very specific population circumstances and characteristics, this raises, the stakes even higher in terms of making sure that we build these systems for all rather than the few, and that we build these systems in ways that are culturally sensitive, build these systems in ways that are clinically responsive, and build these systems in ways that, again, function in a manner that is responsive to conditions that oftentimes go underserved or not served at all in the context of healthcare. And so there are any number of issues here that we'll talk about, the ways in which bias, for example, presents throughout the development of AI and the application of AI, any number of studies that we'll reference and cite in our white paper that have demonstrated empirically, how this technology, for all of its brilliance and for all of its sort of breakthrough success, the threats and the risk that are clear and apparent are quite striking. And so again, as we begin to see these technologies being deployed, how do we make sure they're deployed in ways that are safe? How do we make sure that they're deployed in ways that are responsive to community needs? And that requires, right, building teams, that requires building models that take these kinds of issues into consideration, makes them a priority consideration as opposed to an after the fact consideration. And so we're hoping to work with you to sort of build a framework, build guidelines, build policy recommendations, community stakeholder engagement kinds of activities to ensure that all voices, all perspectives, and all forms of expertise inform and support the development of more equitable decision-making as it relates to the design and deployment of AI in the context of healthcare. I'll stop there, and I think there's more to be said.
Wow, I just wanted to say wow. That was a lot, but I heard a lot of words or language that I think is really useful for us to guide this conversation tonight and guide the interactions that we will have with our members and the public. For everyone's awareness, in the chat box, I was capturing some of the things that Dr. Watkins said that I wanted us to just pause and ponder on. Roadmap. We want to achieve a roadmap. A roadmap gives you directions. A roadmap acknowledges if there's something alarming or something concerning. A roadmap says this is the best route to take. And so this is a holistic overview of AI. Build these systems for all, continuing to have a framework that points due north, that points to equity, right? Everything that we do, we want to make sure that we are identifying what is aligned with equity and that we are designing and building out that way. And people are starting to put questions in the QA. We love it. We're going to get an opportunity to return to it. But just a few things that I'm seeing, Dr. Watkins, questions around bias in algorithms, questions around whether or not these predictive capabilities will be able to rightly determine who should receive certain treatments, and how do we control for biases. And then another point, environmental issues, or as someone wrote, environmental racism in designing or building AI. How do we make environmental considerations? So with that, I'll yield the floor back, and I believe now we're going to have an opportunity to meet some of the other members of the task force.
Yeah, I'd like to ask my fellow colleagues and task force members to come on camera and unmute. And I'll have each of you introduce yourself and maybe just say a little bit about your expertise and some of the things that you'll be bringing, to the task force and to our, consideration of the many issues that I've noted and some things that I haven't noted. And we'll go in the order as you appear on my screen. That would be Dr. Rubin, Dr. Matt, and then Taylor, who will soon one day be a doctor.
Thank you, Craig. Hello, everyone. I'm Ruben Rudnasingham. I am the head of health innovation at the Dell Medical School at UT Austin. We have a medical school, we have specialty clinics, and we have a couple of hospitals that we work in for clinical care, research, and education as well. And we deploy, we develop, we review multiple AI algorithms every day. As you can imagine, more and more developers are developing these AI algorithms to do various things in healthcare. And for the most part, most of them have the potential to actually amplify disparities and amplify inequities. And but it doesn't need to be that way. We have seen evidence that there can be a fundamental shift if we reimagine how these algorithms are developed and deployed, and most importantly, monitored through the input of the communities that are that are affected as early on as possible. And we could see that shift already when we do that. And so conversations like these, like we're having today, are crucial to sort of supporting that shift. But we're optimistic, but we do see how AI algorithms, especially ones that are trained on data that do not represent the communities that they're applied on, can often fail with drastic consequences. So thank you for having me. Thank you, Craig, for inviting me to be on this panel. I'm excited to contribute.
Thank you.
Similar to Ruben, I'm extremely excited to be here this evening. I'm so privileged to join this group and to talk about these important topics. I work at the IC² Institute, where Craig is the executive director. I run a unit within the institute called the Bureau of Business Research, and the name is rather descriptive, but not complete. We're focused on decision making, as businesses generally are, but for us, businesses really can be any kind of organization, even society. That's where we are today in terms of looking at some of these issues with how we might responsibly develop and deploy AI in healthcare systems for the benefit of everyone. And what I bring to the table is an interesting background of analytic, computational, mathematical decision-making modeling, but also a long history of social science approaches to actually understanding how people do make decisions. So how we might make decisions better, as Craig was talking about, in terms of risk stratification and resource allocation according to risk priorities, but also then an understanding of how people think and how they include biases in their thoughts. And as I approach this task force, one of the things I'm really interested in is what Craig mentioned earlier about how technology and AI specifically is really entangled within our society. That I think is a good lens for me to mention briefly how we're focused on social determinants of health, or non-medical drivers of health, and how all that lived experience, the context of people's lives, really complicates the decision-making that we're trying to make that we're as humans, and that we're trying to use technology in the form of AI to support our human-centered decision-making with these tools. And so there is this information, there's a lot of questions in the Q&A about the medical records and the integrity of the medical records. That's all quite valid, and we will deal with that. But part of what I'm bringing to the table is this focus on the external context within which people live their lives, and how that can add to and actually be a causal factor for lack of equity, disequity, and unfair outcomes. And I'll pause there to let Taylor take some time to introduce herself.
Thank you. And thank you to Dr. Watkins. And hello, everyone. My name is Taylor Wilds. I'm a third-year PhD student in the developmental psychology program at the University of Texas at Austin. And generally, my research focuses on how maternal health shapes caregiving behaviors and her infant and child's physiological regulation. I use wearable sensors like audio sensors and heart rate data to collect data from the home to understand how early stress and support systems influence development across generations. And so for this task force, I'm contributing a section on maternal health and maternal mental health disparities and wearable technologies, particularly how AI-driven tools can either support or undermine health equity in this space. I draw on my work from two studies, an NIH-funded project that uses these wearable sensors to capture mother-infant interactions in their home, and as well, I'm also working on a qualitative study with Black and Latinx mothers and maternal health providers, so doctors, nurses, and doulas from the community, to get their perspectives on some of these technologies and how to make these protocols more inclusive in these populations. So my section will outline how AI-enabled wearables could possibly identify early signs of maternal stress, infant dysregulation, child behavioral problems, but Also want to highlight the risks in these, the risks of bias, over surveillance in these communities, and the fact that a lot of these algorithms have not been validated in diverse populations. And yeah, thank you.
Perfect. Thank you. Thank you. Thank you. One thing I do want to acknowledge as well is that this is just part of the task force. We will still have a few members from Sanofi as well, maybe an extra 1 or 2 people. So I do just want to acknowledge that yes, we have a great group, but it's going to get even greater as well. So I do want to acknowledge that. Dr. Chris, I will pass it over to you.
Thank you, Dr. Tony. And we are very excited and we are very honored to have Dr. Watkins at the helm and to have Dr. Rubin, Dr. Matt, and soon to be Dr. Taylor. We're going to speak into your future, contributing to this important project. But you too have a level of expertise. You have questions, you have experiences that you've had in your life or just in engaging in healthcare systems. And we want to make sure we understand that and that is reflected back. So hopefully by now you understand why we're doing this. It was so important for this partnership to focus on AI because AI is increasingly present in many aspects of our lives, and it is definitely increasingly present in healthcare. So if we are going to talk about health equity, we have to talk about the forces, the policies, the practices, the structures, the entities that either impact, drive, influence, shape, or determine those health outcomes. So that is why Track E is getting this type of drilled down specific attention tonight. You heard the word artificial intelligence, abbreviated as AI. Dr. Watkins explained that. You heard a little bit about machine learning, and we've grouped that alongside other emerging technologies, whether we're talking about wearables that you've heard people mention, and the different types of capabilities within AI and ML. And so again, in summary, we wanted to make sure we captured exactly what the goals of the task force are, to be able to understand the trends, the things that you all have raised. You've raised questions around data, whether it is safe, whether it is confidential. You've raised questions around biases, how biases have already impacted Black and other communities of color, and what are we going to do to use AI not to maintain the status quo, but AI to disrupt in a healthy and positive way. You heard Dr. Watkins talk about the framework. That framework is going to be crucial. We are confident that this framework is going to just answer many of the questions that we have had shared tonight, but to the larger field, to say this is an approach to how we safely, how we ethically handle artificial intelligence, machine learning. And what is a white paper? So Dr. Watkins, I'm cognizant of time. I want to move us forward so we can begin to engage and answer some of these questions. But is there anything that hasn't been said so far that you think you need to explain before we move forward?
I think we've sort of struck a lot of the important notes, and so I think we can proceed with how you and Dr. Tony would like to spend the final minutes that we have for this webinar.
Thank you. Dr. Tony, I yield the floor.
Perfect. Thank you, Dr. Chris. So everyone, this is probably one of my favorite parts of tonight's webinar. We are going to be interactive and we want to hear from you all. What we are going to do right now, we have a couple of questions. We're going to do a couple of Zoom polls where we're going to get input from you all. As you all can see, this first question right here, which aspect of artificial intelligence in healthcare needs the most careful attention to reach its full potential? You're going to see that question as well as some response options that we're going to talk about in just a minute come on your screen in just a few moments. Once those response options come on your screen, select the answer that you feel resonates the best with you. We'll give everyone a couple, maybe a minute or two, 45 seconds to respond. We'll showcase the results, and then Dr. Watkins is going to react to those results for maybe just a minute or two, right? So with that, want to highlight some of these response options: bias in algorithms, data privacy and security, lack of transparency or explainability, digital access and the digital divide, cost and affordability, and replacement of human judgment in healthcare. Dr. Watkins, if you can you speak to any of these response options, maybe expound on them a little bit, define them for the people on the webinar this evening?
Yeah, I think, and as I just sort of scrolling through so the Q&A segment here, obviously a lot of questions about the ways in which bias are embedded in and how they present throughout the development cycle of artificial intelligence. And so, and what we've learned in our research, right, is that bias presents in a number of different ways. Bias can even present even before an AI model is built. Bias can be based on certain assumptions that are made about a particular clinical condition or about a population. I think it's important to say that most AI systems that are developed and deployed today are what we might call sort of, they have a very specific task. It's designed, for example, to conduct a risk stratification or a quality of life or a prediction or a ranking. And so in that sense, right, it's a very specific, narrow kind of application. But oftentimes, right, what we're seeing in the research is that even through that sort of narrow definition or task expectation for an AI application, certain biases can be embedded in terms of assumptions that are made about, who this is likely to serve. And of course, right, a lot has been made, comments have been sort of presented here about bias in the data set, who composes that data set, what kinds of data are sort of integrated or input into a model. And there are obviously, right, very clear evidence empirically over the years about how that functions. But there are other ways in which bias could happen in terms of deployment, the need to constantly monitor a system to ensure that it's not disparately impacting some populations versus others. The concerns around the environment, I think, are quite critical and quite valid here in terms of as these models are being built, as these data centers are being built, the impact on communities and which communities are disproportionately sort of impacted by the environmental sort of downstream impacts of AI, I think is really important. And then, of course, right, sort of thinking about some of the policy decisions that are here. But the other thing that I think is really interesting here, right, is this relationship between machine intelligence and human intelligence, something that we've been thinking a lot about in research that we've been doing, for example, at the IC² Institute. And so concerns about decision making, right, and how do we ensure that humans maintain some sense of control and agency over these systems will be critical. And so striking that balance between recognizing the power of computational modeling and algorithmic decision making, but also recognizing its limitations and recognizing, right, how human expertise, human awareness, human understanding of all of these complex nuances is a critical aspect to what we're thinking about here. So these are all, I think, really important issues. We'll try to address and reflect many of them in the white paper. But obviously, right, these issues, just continue to expand and continue to develop multiple dimensions, that require, very detailed considerations.
Perfect. Thank you, Dr. Watkins. So everyone, you all should now see a Zoom poll on your screen. I see the answers are rolling in. The answers are rolling in. So we'll give everyone a couple of more seconds to answer the question. Once again, which aspect of artificial intelligence in healthcare needs the most careful attention to reach its full potential? You can see bias in algorithms, data privacy and security, lack of transparency and explainability, digital access and the digital divide, cost and affordability, and replacement of human judgment in healthcare. So right now, we're at about half of the number of people in the Zoom room, or Zoom webinar rather, that have responded. We'll give it maybe about 15 more seconds or so. Go ahead, click that Zoom poll, put in your response options. What I'm going to do afterwards, I'm going to end the poll, share the results, and then Dr. Watkins, I'll have you respond to those results for just a brief moment. So with that, everyone, I'm going to go ahead and end the poll here. and I'm going to share the results. Hopefully everyone can see it. And wow, it is a 3-vote difference between bias in algorithms and replacement of human judgment in healthcare. Dr. Watkins, what do you think about that?
Yeah, no, I could not agree more with that distribution. Those are obviously, I think, critical areas that need to be addressed. And I think Dr. Chris and Dr. Tony, you set the tone in terms of it's important to understand what's at stake here. And it's also important to understand, why it's important that our voice is heard, why
Mhm.
our perspectives are included. And so being able to sort of map this, right, via events like this and your other engagements with your members around the country will really help us to sort of understand and echo that voice and identify those concerns and make sure that we, effort in a way that really begins to influence the broader discourse around these issues. But clearly addressing bias in algorithms is important as we begin to, experience a society that's increasingly, for better or worse, algorithmically driven. Some would say algorithmically determined.
Perfect. Thank you, Dr. Watkins. So with that, we will move on to our next poll question here. Which of these topics is most important for the white paper to address in detail? We have the historical context of health disparities and how AI could amplify them, case studies of both successful and failed AI implementations, a technical deep dive on how algorithmic bias is created and detected, practical guidelines for responsible and equitable AI implementation, and balancing innovation with patient safety. And we do have one more here, stakeholder roles and responsibilities. With that, I'm going to go ahead and launch this poll, Dr. Watkins, while you are explaining a little bit about some of these response options.
Yeah, these are really important. I think most people likely in this webinar understand that there's a long and very meticulously documented history of the ways in which disparity and inequity are just sort of baked into our healthcare system in terms of who has access to healthcare, who doesn't have access, the quality of that access, and just the ways in which patients are treated by the healthcare system, affordability. And the reality is, right, is that those institutional features oftentimes are reflected, unfortunately, in the sort of algorithmic models and machine learning models that are applied. And so one of the big concerns about AI, right, is its ability to not only replicate a lot of the sort of inequities that we've experienced in society, but to scale and automate them in unprecedented ways, right? To expedite and to automate them in ways that become striking, in ways that become quite impactful and significant in terms of health outcomes. We've spent a lot of time working with clinicians to be very detailed and very granular and specific about the precise ways in which bias manifests itself in algorithmic
Mhm.
models, and then how do you sort of build sort of mitigation techniques to sort of reduce the impact of bias.
Perfect, perfect. Thank you. And I see we have over 200 folks responded. So I'm going to go ahead and end the poll right there and share the results. Once again, we got another close one. The historical context of health disparities and how AI could amplify them, closely followed by practical guidelines for responsible and equitable AI implementation.
Yeah, I sort of said a bit about the historical context. I think this other one that's selected here in the identified here in the distribution. I mean, this is I agree with our friends here. That identifying guidelines that really point a way forward in terms of what responsible and equitable applications of AI will look like will be important. So it's important, right, not only to document the problems and the challenges, but also to document, right, where things have either been done successfully, done well, or at least done with the intent for ethics and equitable impacts, sort of documenting and demonstrating how those have been implemented and how they might serve as a model, if you will, or a framework for how we move forward will be really important. So this is great feedback for us, I think, the task force.
Perfect, perfect. Thank you, Dr. Watkins. I'm going to go ahead and stop sharing there. And we have one more poll before we move into the dedicated Q&A section. What type of policy proposals should the task force focus on? We have data privacy, algorithmic transparency, ethical governance and accountability, cross-sector collaboration strategies, standards for documentation and reporting, equity impact assessment requirements, and public application toolkit. So with that, I am going to go ahead and launch this poll. Please go ahead and mark your response options. Dr. Watkins, talk to us a little bit.
Yeah, the governance and accountability, I think, is really important. Governance is really about both the formal and informal policies and guidelines and expectations, values that we sort of build around these systems. Bringing in community stakeholders, bringing in, greater voices. Some of the task force members alluded to is really important here. And so this is really about, how do we leverage the power and the voice of the community to sort of inform and in some ways impact the way these systems are both built and then also how they're deployed.
Perfect, perfect. Thank you. And what I'm going to do, I'm going to go ahead and end the poll here. And we have an overwhelming majority ethical governance and accountability. What do you think, Dr. Watkins?
Yeah, no, I think they're exactly right. In some ways, right, if you don't have sort of an ethical compass, if you will, for where we think we should be going with this technology, how will we ever get there? And so, in some sense, right, this sort of governance and accountability sort of intervention, I think, is quite critical in terms of just establishing some parameters for the vision that we have. And then how do we sort of build mechanisms, build institutions, build culture and norms that help us sort of, get to those outcomes that we expect and want from this technology.
Perfect, perfect. Thank you, thank you. So with that, I'm gonna go ahead and stop sharing. I'm gonna call Dr. Chris back into the Zoom world here. And what we're gonna do, we're gonna go ahead and move into some dedicated Q&A. One of the things that I have seen in the Q&A feature while we've been talking, Dr. Watkins, if you could somewhat briefly, can you explain to the people exactly what a white paper is? There's been a couple of questions just wanting you to define what is a white paper.
Yeah, great question. So a white paper in a context like this is really an opportunity to consolidate a lot of the sort of latest insight, research, knowledge that has been built up over the years in terms of this field. And a white paper is a way of essentially providing sort of a representation, if you will, of a kind of state of the art. Where are we now with this technology in terms of research? What do we know? What are the challenges? What are the opportunities? And how do you organize that in a way that's informed by, academic research, scientific research, but it's not necessarily an academic or scientific sort of expression of knowledge, but rather an expression of knowledge that summarizes, assesses, and evaluates that scientific and academic knowledge in a way that's accessible and in a way that may be actionable to your users. So in this regard, what we'll try to do is to capture knowledge, state-of-the-art knowledge, but then also provide some guidelines, provide some recommendations for actions that may be taken as a result of this accumulation of knowledge and how it may translate into real-world application and impact.
Wow, that's another wow. You all heard me say that earlier tonight. I am really enjoying this conversation. Dr. Watkins, thank you so much for being able to break down these words, the terminology, the concept for people. What I want to do is just give us about 10 minutes to pull out a few of these questions from the Q&A, and we'll have you react to them and see if we can help people to deepen their understanding. We know this is a process. This is just the beginning, but so that people can walk away saying, okay, I feel like I'm moving in the right direction. I'm going to start with the last question that was recorded in the Q&A. And it says from Rafael Lopez, Dr. Watkins, in this current non-supportive climate for DEI, how are you seeing health systems respond to the importance of the AI design strategies that you advocate for? How do we get their attention and budget? So in this climate, how do we get health systems to respond to the importance of AI design strategies that you're advocating for? And how do we get their attention and budget?
Yeah, and it's a great question. Thank you so much for asking that question. You know, I mean, we all sort of understand the environment that we're in and some of the challenges that environment presents. But when I talk to managers of healthcare systems, when I talk to clinicians, they're very clear that the only way in which they can integrate and deploy AI is if they trust it and if their patients trust it. And that means they can't integrate or try to deploy systems that they know are inherently biased, are less reliable when applied to certain populations as opposed to other populations, because their life and death, right, is at stake here. And so no healthcare organization would want to deploy an algorithm or a model that they think, right, would lead to some type of a misprediction or lead to a sort of a risk stratification mechanism that's simply improper or inadequate for the population that they're serving. And so for them, these aren't, nice to have kind of considerations or nice to think about, if we could, but because they're so central, right, to life and death decision making, because they're so central to the state of healthcare and how they support patients and serve patients, it's absolutely critical that these issues be sort of first and foremost if they're thinking about AI. And so the reality is, right, is that the vast majority of clinicians in this country aren't integrating AI into their everyday clinical decision-making processes for a number of reasons. And one of those reasons has to do with trust. One of those reasons has to do with needing validation and verification that these systems are working, that these systems do apply and can be applied to diverse populations. And until they know that, and until they can be assured of that, it just simply restricts their ability to sort of integrate these technologies into the workflow. And so we see experimentation happening in certain, corners of the clinical research field. But in terms of everyday adoption and everyday application, it's very limited, primarily, right, again, because there's still concerns about trust, still concerns about validation, still concerns about bias, and how that might undermine the safety and application of these systems.
Excellent. I see a question here from Michelle Russell, and the question reads, and then I'll copy it into, or Dr. Tony, if you can copy it into the chat box for everyone. What kind of questions should patients ask of their healthcare providers to ensure that the provider's AI tools are a benefit and not a hindrance to individual health issues and goals? So again, what type of questions should patients ask of their healthcare providers to ensure that the provider's AI tools are a benefit and not a hindrance to individual health issues and goals?
Yeah, it's a great question, and in our research with clinicians, they're beginning to note with more and more frequency that these kinds of conversations are coming up, right? That either patients are bringing, information that they've collected from ChatGPT and saying, "Hey, what about this?" Or, ChatGPT says this, but you say this. Um, and vice versa, right? If a clinician is integrating AI into their clinical decision making, we like to know to what extent are you disclosing that, right, to your patients, and to what degree are you and your patients aware that that's happening. But I would say question from if I'm a patient, some of the things that I might want to ask a clinician is if they're using an algorithm, right, to support their decision making. I might ask, for example, what patient population was this algorithm trained on? In other words, was it trained on a population that has clinical, demographic, social, financial features that are similar to mine? Because we know all of those conditions and more impact health outcomes and impact the kinds of healthcare that people can and should receive. You might want to know, for example, to what degree has this AI model, has this results and performance been validated? And so against what metrics and against what measures? And importantly, I would want to know as a patient, to what extent does the clinician exercise some degree of authority or agency over the system? In other words, what we don't want, right, are clinicians who are just blindly accepting, right, the recommendation or the prediction of an algorithm without asserting their own clinical expertise and experience in that process. And so those are the kinds of assurances that I, as a patient, would want from a clinician as we move deeper and deeper into an AI augmented environment.
Excellent. And that leads into a question. I think it's very similar. But first, I just want to acknowledge some themes that are in many questions. There are many questions around data integrity and confidentiality. There are many questions around trust. There are many whether like it's trust that has been broken between healthcare systems and patients, specifically in historically excluded and marginalized groups, or trust around the AI tools that are being deployed. There are many questions around safeguarding, but I think this one is a good bridge question. This comes from Beverly Maurice. Bottom line, who will be responsible for keeping the AI ethical? Will healthcare providers become too dependent on AI, leading to a higher lack of empathy? Again, bottom line, who will be responsible for keeping the AI ethical? Will healthcare providers become too dependent on AI, leading to a higher lack of empathy?
Yeah, Beverly, it's a great question. I mean, there are any number of stakeholders, right, who will be responsible for holding AI up to the highest ethical standards possible. Clinicians themselves, policymakers, healthcare management, stakeholders and systems. But I would say maybe, certainly an important, if not the most important stakeholder is just going to be, citizens, patients, right? All of us. In other words, right, to what degree are we in a position to be able to mobilize our voice and mobilize the power of our voice to compel more ethical applications of this technology, because I think that's absolutely critical. And so, in this sense, right, the degree to which we demand responsibility, the degree to which we demand sort of ethical applications of the technology, because I think Beverly, I think you're right. If left up to the healthcare system itself, and left up to, unfortunately, what is oftentimes a driving motivator within the healthcare system, and that is economics, profit margin, healthcare for the few, for those who can afford it, that if those motives are left unchecked or unchallenged, they will likely play a significant role in terms of shaping what an AI healthcare infrastructure looks like. And I would hope, right, and that would mean, right, sort of essentially deferring to the algorithm, deferring to the most efficient means of making clinical decisions, as opposed to the most human-centered means of making clinical decisions.
And there's something related to that, and I think it's so important for us to go back and revisit this. Do you think there is a particular governance structure, whether those are AI ethics boards with community representation, that are most effective at overseeing AI deployment in healthcare, or is it mixed? And so this keeps coming back up. So let's double back with that one more time. Is there one that we've seen in the literature, and we're still early, right? But is there one in particular, one governance structure that might have a better impact or outcome than another?
Yeah, I mean, I think right now, the field is still struggling to figure out, which model might yield the greatest impact and the greatest benefit. But I do think, any, approach to governance that privileges bringing in that community stakeholder voice and perspective is absolutely, critical. And so, in other words, right, populations that stand to gain the most or be hurt the most, figuring out ways to leverage their voice. And I know that this is work that each of the task force members are involved in, and so we will reflect some of that research and some of that knowledge into the white paper. But I do think we have to think about multiple approaches to governance, right, and how it's going to operate at different levels. I think the question then, so at a management level, at a policy level, at a community level, I think all of those sort of governance provide important mechanisms for governance. And then the question, of course, becomes, how do we ensure that that each of those particular governance mechanisms has, if not equal voice, near equal voice, right, in terms of shaping what a health AI infrastructure and care model might look like moving forward.
Thank you very much, Dr. Watkins. Thank you very much, everyone who is around this virtual webinar table, for giving these questions and for supplying these good thought prompts. And so again, I want to emphasize, we are going to collect all of the questions that were asked tonight in this process and ensure that the task force has access to these questions. You've heard a lot of these themes repeated. You've heard a lot of these themes already addressed or amplified in some of the responses that Dr. Watkins gave, whether it was in response to a particular question or when just talking about the topic as a whole. And also this recording will be sent back out to everybody who registered for tonight. And you'll have an opportunity, if you registered and were not able to participate, to take the polling questions, because we want to hear from everyone. We only got through 3 polling questions, but we actually have 3 more. And it addresses many of the things that you all have raised tonight. So look out for that recap email. And with that, Dr. Tony, take it away.
Perfect. Thank you, everyone. And thank you, Dr. Watkins, the task force. This has been phenomenal. This has been excellent. So thank you all. What we want to do, though, we want to close with something on a high note, if you will. As you can see here on the screen, there is a question. What are you most excited about regarding artificial intelligence in healthcare? If you are on your phone, or if you have your phone available, your smartphone, you can scan that QR code and it will take you to a word cloud. If not, if you are on a desktop, you can go to Menti, MENTI.com. I see Dr. Chris dropping it in the chat, and use code 63267730, and you can drop in a word or two about what are you most excited about regarding AI in healthcare. I see Star Trek level healthcare, unbiased great care, efficiency, improved diagnosis, improving health outcomes. These are all things that we are really looking for. I see fair allocation. I see access and innovation, advancements and cures. Efficiency, that is the word that is rising to the top. It's the biggest word here. I see equity there. I see prescription accuracy, more informed doctors. This is what we are all excited for. This is what
diagnosis. I wanted to call that one out. Trust. There's that trust word.
There we go. Trust. And you can see efficiency and equity rising to the top, right? And I think, and I don't want to speak for anybody else, but I feel very comfortable in saying that there is a lot of promising, hopeful, good use for AI in healthcare that will help us. And when I say us, I mean the collective us, you, me, neighbors, aunts, uncles, family, friends, to be more efficient and for us to get those equitable resources. So with that, man, this is fantastic. With that, Dr. Chris.
Hey, we're out of the gate. I am just so thrilled about the conversation that what started tonight. And this conversation is going to continue to grow. Again, I just want to recap. You will be able to receive a recording of tonight's webinar. You will, when you receive that recording, will also receive the polling questions. You'll have an opportunity to respond to 3 more questions in addition to the questions that we shared tonight during the webinar. And finally, the responses and feedback that we received through the Q&A. One, we wanted to call out several of them. We were able to go through 4. There were well over 80 now. It was well over 70 when I last checked. And there were a lot of consistent themes. I want to thank Dr. Watkins for doing a phenomenal job, phenomenal job of helping our audience begin to understand what AI is, what machine learning is, Why that is important to our population and our community specifically. Are there things that we should be concerned about, perhaps? And we heard that tonight. But how can we take those concerns and translate them into more equitable, ethical, and improved responses? And that's the goal of the task force, and that's the goal of ACE Your Health, is always moving the community toward health equity. And so thank you for being an active participant. Stay tuned for other opportunities to interact with the task force. We will publish the task force white paper with that framework, and we will then have another conversation about what the white paper found, what we heard, and what we believe is the best course forward. So Dr. Tony, I think we have one more slide, because we never leave without what? Asking people to do the survey. Tell them again how many we've done.
We are over 20,000 completed surveys, and that is thanks to all of you all. But we got to keep going. Not at the finish line yet. We're not there yet.
Wrap it up. We're not, because when does the survey close?
The end of this month, Tuesday, September 30th at midnight, we are taking that survey across the finish line.
Okay, so you will also get a link to the survey, and it's so important right now, Dr. Tony. I believe we have a response from almost every state. We didn't get one from Montana. We did Wyoming, and we didn't get one from North Dakota. If you know anyone who lives in those states, please forward the survey to them, because all of this is a part of the ACE Your Health project. So with that said, on behalf of the NAACP, on behalf of the NAACP and Sanofi partnership, Tanisha Sullivan, who is representing Sanofi tonight, and her team, on behalf of Dr. Watkins, on behalf of our task force members, Dr. Rubin, Dr. Matt, and soon to be Dr. Taylor, on behalf of the National Health Committee. I saw a few of our members on the National Health Committee that were on tonight. I believe I saw Dr. A. I believe I saw Vice Chair Edwards. So we want to thank you on behalf of that National Health Committee, Dr. Dwayne Proctor, who leads it, who was not able to be with us tonight, and our president of the NAACP, none other than Derek Johnson. We thank you for tuning in, and we thank you because your voice matters. Have a great evening, everyone.